Hi everyone, my name is Alexandra. I'm one of the PAs here at Advanced Aesthetic Clopus Plastic Surgery, and today I would like to talk to you about some Botox myths. There's a lot of misinformation out there, so let's clear a few of those things up together. All right, let's start with one of the biggest myths about Botox. Botox will make you look frozen. That is not true. When done by an experienced injector, Botox is supposed to relax targeted muscles. You will still have the ability to show emotion. We just want things to be a little bit more relaxed and refreshed. The goal is to look refreshed in your natural state, not a frozen face. Okay, myth number 2. Once you start Botox, you'll have to keep doing it forever. That is also false. Botox gradually wears off in 3 to 4 months, and your muscles simply go back to their normal movement at that time. If you ever decide to stop doing Botox, the worst thing that will happen is you'll just go back to your baseline, and wrinkles will gradually reappear. And for that reason, people like to stay Botox because they enjoy the results, but it's completely your choice. You do not have to stay Botoxed. Okay, another common myth about Botox is that it is only for older people, and that is not true. We actually see a lot of patients in their 20s and 30s, younger patients that are really wanting to do this for preventative treatment so that lines do not stay etched in. And so we do this more to just restore, maintain their results, and hopefully do more preventative treatment versus corrective treatment. So these are just a few of the most common Botox myths cleared up. The key takeaway is that Botox is safe, effective, and customizable when done by an experienced injector. If you're interested about what Botox can do for you, please schedule a complimentary consultation with us here at Advanced Aesthetic Clopus Plastic Surgery and Med Spa. Thanks for watching, and don't forget to subscribe for more aesthetic and skin treatment tips.